Dr. Jerisa ER. Hi, happy Valentine's Day, after Valentine's Day. I'm Dr. Jerisa ER, your board certified emergency medicine physician. I help confused, nervous, anxious patients in emergency health conditions. With my expertise, you will leave happy, informed, and back to baseline again. So it is American Heart Month. That being said, I'm sure you have heard a lot of education about heart disease. And so what I want to share with you is one of the common symptoms that we see in the emergency room, and that is palpitations. Very, very common, and never really to be underestimated or made to feel as though it's just anxiety. And so I wanted to come and share with you today on your tips for your ER trip about palpitations. What does it mean? What do I do when I experience palpitations? So to break down palpitations for your understanding is to put it in categories of fast heartbeat, irregular heartbeat, or both. So if you're older, older than 50, 55 or so, and you have both, your fast heartbeat greater than 100, then you need to have that evaluated every time go to the emergency room, because fast heartbeat and irregular heartbeat, even if it's fast greater than 100 alone, could be life-threatening. And so every time that occurs, especially if you're older, you've had it before, you're having symptoms, you need to go to the emergency room. When you're younger, that's when a lot of patients are like, what do I do? I'm experiencing a fast heartbeat right now, or I feel my heart kind of, skipping a beat. You will feel it. It is, if you're active and you're, having a busy day, then you're not you might ignore it unless you get symptoms like dizziness or you feel lightheaded. But if you're, kind of relaxed and you're in tune with your body, you might say, I'm kind of feeling, my heart's kind of, skipping a beat right now. I'm feeling a little discomfort, and it can get such that it takes your breath away. And so, when it happens, you want to get it evaluated, especially if it's your first time. So when it comes to first, I really feel as though if it's your first whatever, your first palpitations, your first dizziness, your first I almost passed out, you need to have that evaluated, because it can be a sign of something else that's concerning, and you want to know what's the cause of it, because it could be treated if it's diagnosed. If it's not diagnosed, then you don't know. You really don't know why this is happening. And so we see patients where they experience, hi, Dr. Tony, hi, Dr. Drayon. We see patients where they experience palpitations, and, they might have it for maybe an hour or two on a Monday, and it goes away. And they think, I'm okay. I had palpitations. I felt that kind of skip beat, but it went away. And then it comes back maybe, a week later, or it occurs again on the weekend. And you're like, oh my gosh, what's going on? I kind of feel my heart kind of skipping a beat. That needs to be evaluated, because there is treatment for, palpitations and irregular heartbeat when you know the cause. If you don't know the cause, then you're not going to be able to treat the underlying condition. So I'll give you an example. In my case, I actually had palpitations. Well, back in medical school, I had palpitations that took me to the emergency room, because it was like, oh my gosh, it really took my breath away. And during that time, in medical school, it's a stressful time. You're not eating the best. You're not getting the best nutrition. And so in my case, when I went to the emergency room, because it really got unbearable, my potassium was low. And so because I did not ignore it, the doctors were able to say, oh, wow, your potassium is 2.6. What's going on? You're a stressful medical student. Yeah, I'm not eating. I'm not eating the way I should be. And so thankfully, because it was my first, and because I didn't ignore it, I went to the emergency room and had it evaluated. They were able to diagnose that, in my case, and actually very common, low potassium. When you go to the emergency room, some of the other tests that will likely be done, of course, the EKG. But an EKG is just a kind of a 30-second split rhythm. It shows your rhythm at that moment. Your doctor, depending on how aggressive they are, they may also do a Holter monitor for a couple of days or an event monitor for a couple of weeks. You may also, if it's your first, which I recommend you get full evaluation if it's the first time it's occurring, you may also get an echocardiogram. The reason why an echocardiogram is good is because you want to know if there's any structural abnormalities to your heart. They will also likely depend on the doctor. Again, some doctors are more aggressive than others. They may also do a stress test. In my case, I actually had a stress test as well because my doctor was, let's check everything out. Okay, let's not just say it's your potassium because this is your first time occurring. And the benefit of doing a stress test, not every doctor would do a stress test. And this isn't an emergency room. This is outpatient workup. But the benefit of doing a stress test, even if you're, 19, 20, is because when you're exercising your heart, you're on the treadmill, and you're doing a brisk walk, and then that brisk walk turns into a jog, and you start sweating. But that's real life. It's a real life picture of you doing a lot of activity. And during that time, they're monitoring your heartbeat and what's going on beat to beat with your heart. So that's why I really recommend that when you experience either a fast heart rate, you check your pulse and you see that it's fast, greater than 100, or you feel kind of that skip beat, that you don't ignore it, especially if it's your first time, because it could be low potassium. It could be your thyroid is overacting. Don't just say that, oh, I drink a lot of caffeine. Now, certainly there are a lot of patients, and it's good that you think about what you've done during that day that might be a cause of a certain symptom. Did I have a salty meal? Did I eat a large meal and it's stuck here in the indigestion? You can map out what you've done during the day. Great, do that. Maybe you did have a lot of caffeine. Maybe you haven't been drinking a lot of water. Dehydration is also another common cause of palpitations or a fast heartbeat. Maybe you're ill, you have a fever. Those are common, yes, benign causes of fast heartbeat, irregular heartbeat. Caffeine, dehydration, perhaps, fever, illness. Those are common causes. So if you can think about, I think I might have another reason for palpitations, then absolutely. But if you can't find another reason and it's your first, then those are the tests that you need to have, and definitely go to the emergency room and have that evaluated. So that's it for today's tip for your ER trip. Thank you so much. Thank you everyone for following, for sharing. Share this video, save a life. Really appreciate it. And also the audiobook. The audiobook, www.tipsforyourERtrip. It's free. It's free. And actually there's a bonus in there that's really dear to my heart. And so the goal of Tips for Your Trip is to make your emergency room experience more smooth, and for both parties, that you'll kind of get a better understanding of what you can do, that will help your emergency room experience, the wait time, even the conversation you have between the doctor be, more smooth and improve your overall ER experience. So that is available. It's free. It's only about 30 minutes. And so I know it will help you. It's already helped some patients that are really near and dear to me. So get that free audiobook and just, continue to live healthy, and live well, exercise, all those things, smoking, quit smoking, all those things, that are bad and that can cause, worsening heart disease. Do those things. Okay. But until next time, I am Dr. Jerisa ER, your board certified emergency medicine physician. Go ahead and follow us on social media and send us any questions, any topics that you would like us to talk about or me to talk about. Definitely shoot those over. Until next time, have a good evening, guys.